Dr. John Torres here with NBC News on this Facebook Live answering your questions. So if you have any questions, please send them to us. We'll try to get to as many of those as we can. And the questions are always fantastic because you guys come up with some thoughts and ideas that a lot of times we haven't thought of. And that's essentially what people are concerned about. And I want to make sure we get those addressed as much as possible. But first thing I want to do is go over a couple of headlines you might have heard over the last couple of days. Number one, we're hearing a lot more about states and cities and different regions opening up. And what most of them are doing is they're opening up things very carefully. They're trying to get their economy started again. And what I usually say is we're kind of walking a fine line between health experts who say, we need to shut down as much as possible for as long as possible to get this under control, which is true. And we have economists, politicians, business owners saying we need to open up so we can get our economy started again, which is also true. So essentially it's walking that fine line between the two, opening them up enough so that the economy can start getting back to shape, back to a near normal, which is what's going to happen over the next few months, but not opening up so much or too early, so that way people aren't having a flare-up. There's not more cases and people aren't getting hurt and they aren't dying because of coronavirus. Because we know once we start opening up and once people start getting back together again, those coronavirus cases are going to go up. What we need to make sure is they don't go up too far or too much and they get under control if they do start flaring up in different parts of the country. Some areas are going to be able to open up before other areas, and so that's something I think that people around the country need to know. The New Yorks of the world, who are having huge cases still, are going to be a while before they open up. Some of the other regions that had limited number of cases might be able to open up on a limited basis, and you're going to see things open more and more gradually as time goes on and we get things under control. Things need to be in place, especially you've probably heard about testing that needs to be in place, contact tracing. All these things are very, very important. So that's the opening up part about it. So you're going to hear more and more about that over the days and weeks to come, about different regions opening up and seeing what happens there. And what public health officials are also doing is they're looking around the world at other areas that have opened up. Italy has opened up a few things, some children's bookstores and stores like that, to try and get some near normal going there. Other countries as well have started opening up. Germany, for example. And what this is going to do, it's going to allow us to look at those countries, at the China and South Koreas of the world who started before we did, to see how they're doing and see what tools they put in place that work for them and what things they did that didn't work for them, so we can learn from each other, which is important right now because this is a pandemic. This is a worldwide pandemic which is affecting everybody. On top of that, number two, the other thing I'm hearing about is in the news article about at-home testing. FDA had just approved an emergency use authorization for an at-home test. It's the only at-home test they have approved for COVID-19. This is the one that can tell you if you are actively infected right now. Not the antibody test, but the nasal swab that can tell you if you have COVID-19 now, even if you're not showing symptoms. As of now, it's a company called LabCorp that has developed it. They're reserving it for frontline workers, and they're reserving it for frontline workers in the majority of states. There's a few states where they can't deliver because of state laws. But what they want you to do is go to their site. You can go ahead and go through the survey there. You have to do a little COVID survey, and a physician will say, yes, you need it. We'll go ahead and send it to you. It does cost, I believe, $119 to get that test done. But it's essentially a nasal swab you put in your nose. Go ahead and send the test out. So it's not a test you do at home. It's more of an at-home collection device, and you send it in. This will save you from going out and having to go through a drive-through or having to go to a hospital or a clinic office, which means that not only are you going to be safer at home, but the frontline providers are going to be safer as well, because they're not going to have to don all that personal protection equipment to make sure you're okay and that everything's fine, and protecting themselves as well. So again, a couple of headlines. One is you're hearing more and more about things opening up. That's going to happen more and more, but it's not going to happen as fast as most of us would want it to happen, but it's going to happen as fast as we can to keep everybody healthy. Number two, that at-home collection device, which is a test that needs to be sent out. Again, it's for frontline workers right now. They say it will eventually be for general consumers, hopefully over the next couple of weeks or so. But it's one more tool we have in our toolbox to try and find out who has coronavirus, to see where it's spreading, see where that curve is coming down, and see what needs to be done in order to keep it under control. But let me see if we have any viewers' questions here that I can go ahead and answer. So,
Kids in sports, will they be able to play this summer? What are we looking at the summertime?
So one of the questions is about kids in sports. Will they be able to play this summer? So number one, so you have to remember that we're going to open things up in a very, very stepwise fashion. And that means that things are going to open up where people aren't going to congregate too much. They're not going to be together too much. And what they're talking about is mostly businesses opening up in this first phase where they can make sure that people are keeping 6 feet away. People might have to wear masks at work, especially if they can't keep that 6 feet away, and possibly taking temperatures throughout the day. The idea here is to make sure that things stay under control, that once we start opening things up, that keeps people from getting too sick. Now, sports, I think, is going to be one of those things that they're looking at very hard right now to figure out what they can do. The simple answer is, let's get the athletes out there and get them playing. We can at least televise that. But you have to remember, the athletes themselves have to stay healthy. And so that's making sure that the athletes themselves don't have COVID-19, don't have coronavirus. Up to 50% of people who have coronavirus don't even show symptoms. So that means a lot of testing before they go out on the field or they go to the arenas or the courts, so to make sure that they're not getting each other sick. On top of that, nothing happens in a bubble. Their families need to be safe as well. Plus, the coaches, the staff, all the workers at the arena or the stadium there also need to be safe. So there's an estimate that for any team that goes out there is about 200 or 250 people that work the arena, work the stadium to keep things going, especially if it's televised. And so all those need to be safe, including their families. And so this is not as simple as, let's get the athletes and the coaches out there, everything should be fine because they're by themselves. There's a lot going on behind that. So I think what you're going to see happening is, probably not in the next few weeks, but I think in the next month or so, you're going to see sports opening up, especially those ones that don't necessarily need to have big teams where they're constantly colliding into each other, but more the sports where they might be separated a little bit, those opening up and possibly being televised. And then eventually you'll see, I think, over probably a year or so, you'll see them add people to the stadium, maybe 25% of the people, maybe 50% of the people, going on and on. Now, as far as kids in sports, that's another issue that's going to be looked at very hard, because when you have kids in sports, number one, you have kids, but you also have their parents and the coaching staff, and those sports are usually team sports, and so they have to be close together in close contact. And we know kids aren't as affected as much by coronavirus, but they can be affected by it, and it can be severe in some very limited cases, so we have to be careful there as well, because we don't want it to spread to kids. We don't want kids to be sick or hurt because of it, but also we don't want them to spread it to adults, and that cause issues as well. So I think the kids sports, it's going to be possibly late summer, maybe not even this summer, maybe next year before kids sports actually come back. And that's one of the hardships behind this, because I know everybody wants to see sports. Kids particularly want to participate in sports. It's a very, very healthy thing for them to do. But first and foremost, we need to make sure the population in general stays healthy.
Can you talk more about people who are testing positive? Are they old people, young people? Is it kind of all over the place?
So the question is about people that are testing positive. Are they old people, are they young people? Is it a variety of age groups, locations? Well, right now there's been a couple of studies. So again, remember, there's two different types of tests. One is the coronavirus, or the COVID-19 test. COVID-19 is the disease. The COVID-19 test that tells you if you actively are infected. In other words, that the virus is still in your body. And that is showing that people are sick at different rates around the country. The problem is most places are only testing people that are sick or have symptoms. And so they're not getting those people that don't necessarily have symptoms, which could be half the people with coronavirus. And so they're missing a lot of people. So to try and figure out what's going on, because they're missing all those people, there's that second test, the antibody test. This tells us if somebody had coronavirus and recovered from it, even if they didn't know it, because they've developed antibodies to it. That antibody test can look to see if they've had it over the last few weeks or perhaps even longer. There's been a couple instances, one in California, one in New York, where they tested populations and looked to see who has it. By some estimates, 3 to 4% of the population has had it, and a good majority of those, up to 40%, didn't know they had it. And so again, it could hit a variety of age groups. They're showing it in different age groups, and they're showing it in different regions. Now, the other thing you have to remember is the older you are, the more likely you are to suffer consequences from this, and the more that you have those underlying health conditions, you're also going to suffer some consequences. The risk is higher. And so the younger ones, the ones that are healthier, might have it but might not show it. And so even though it looks like on the COVID-19 test, where they're getting the active test to look at it, we're only reserving that for the sick one. On the antibody test, we're finding out that basically across the general population, we're seeing coronavirus. So it's not isolated to one age group or one region. As most experts say, it's not if it's in your region, it's the fact that it is in your region right now. It's just a matter of when it's going to start cropping up, and we want to make sure we keep that under control.
How about things like religious services? Another thing that came up a lot, music parks, speeches, things like that.
So the big question is, how about getting back to religious services or music events, speeches, those types of things? It depends again, because again, anytime you get people congregating together, it can cause some issues. And if you saw the phase plan that the government's coming out with, in phase 1, they're saying 10 or less people get together. Phase 2, it's 50 or less people get together. So that expands it a little more. Each one of those phases requires 14 days, 2 weeks of making sure the cases come down, also making sure the hospital capacity is okay enough to handle any upswing in cases, and that testing and contact tracing are in place. So the issue with religious ceremonies, speeches, different theatrical events, those types of things, is you're going to get people together. So if they can manage it somehow where those people still stay 6 feet apart, perhaps people in the audience wear masks, and people on stage are careful to also maintain that social distancing, then that might work to a certain extent for certain events. And I think that's what you're going to see opening up initially, and then eventually, over the next couple of years, getting back to what our near normal is. And my thinking is that I'm not sure we're ever going to get back to where we were before coronavirus 19. And the perfect analogy I give is if you think about 9/11. After 9/11, we never got back to the way things were before 9/11. Airports, for example. Before 9/11, you used to be able to take a loved one or somebody you're with to the gate at the airport and kiss them goodbye at that point. After 9/11, cannot do that anymore. So things change, and those things become our new normal. I think our new normal is going to change as well, and I think that's going to entail some things to keep us protected from coronavirus, because we know it's going to come back. Once that vaccine comes out, that's certainly going to help, but at the same time, we need to help each other as well.
With this, we know a second wave is coming along, but that said, we've been doing social distancing and masks. Is there something that should happen again? Or we're going to have to be shelter in place again? What do you...
So, and this is a fantastic question. We keep talking about a second wave coming, and that's probably going to come in the fall. What do we need to do to prepare for the second wave coming in the fall? Because right now we're doing masks, social distancing, stay at home, all those things that have proven to be very, very effective. And I think what you're going to see and what they're looking at is saying, hey, let's get a lot of surveillance in place. And that means a lot of the COVID-19 tests and the antibody tests in place to take a look at what's going on around different regions. Once we find out there's a hotspot in the region, plus also have surveillance systems set up in place, so if people start going to the hospital and we start noticing more COVID patients, then basically alerting people saying, hey, we're seeing an upswing here, so they can come in and they can say, okay, it looks like this region is having more COVID patients. Let's start closing things down. Let's start sheltering in place a little bit just to try and get it under control. Because as I talked to Dr. Frieden yesterday, he's the former head of the CDC, and what he told me I thought was pretty interesting. He said just 2 days can make a huge difference in how this thing ends up flaring up or not flaring up. So just 2 days can really develop it, if we miss it by 2 days, into a huge outbreak versus catching it 2 days earlier. So I think the goal here is going to be, once we know it's going to come back, keeping a very close eye on things and saying, what are we going to do in that interim? How are we going to make sure that if we do start seeing more cases, number one, we make sure we understand that the cases are there, but number two, keep them under control. Do the measures. And it might be as simple as telling people, let's social distance and start wearing masks. And it might be as fulfilling as saying, social distance, wearing masks, and also you need to stay at home for a week or two to get this under control. I think it's just going to depend on the area, the concentration of people, and what exactly is flaring up. Now, one of the things when it comes to opening things up, again, we're talking about opening things up, and that's what I started with, the headline about different states doing it. There's a few things that need to be in place in order to do that. Number one, testing. We're talking COVID testing and antibody testing need to be in place. We're not there yet, and hopefully we'll get there sooner rather than later. That has been a big issue, but it's a big issue because it's a very cumbersome issue, and there have been some missteps along the way. Number two, contact tracing. If somebody is sick, then going ahead and finding out who around them was near them so we can go ahead and isolate them. Number three, if somebody is sick, isolating that sick person themselves. And then number four, keeping those flare-ups under control that we know are going to happen. And that is what it's going to take to get us back to opening up and being able to continually open up. I think you're going to see kind of an accordion effect. People opening up, things getting maybe a little bit worse and closing down a little bit, and then opening up more and then closing down more as we gradually continue to open up more and more. But that's going to take a concerted effort. So I think as us at home looking at things, listening to health experts saying, hey, we might need to go ahead and start closing things down a little bit, I think that's not unexpected, and so be prepared for that and be ready for that. And the summer will be a good time to be prepared for what we think is going to come in the fall.
Regarding reinfection rates, should people who haven't contracted the virus be extra careful in the fall?
So regarding reinfection rates, and a couple of things here, should people who haven't got it be extra careful in the fall? I think everybody should be extra careful in the fall for a couple reasons. One, we know that if you have antibodies, you have an immunity built up to it. We don't know at what level those antibodies need to be, and we don't know how long those antibodies are going to last. And so I think everybody needs to be careful this fall. But as far as people who have not gotten infected, probably need to be even more careful, especially if you have pre-existing conditions or you're in a high-risk categories, particularly those above the age of 65. But as far as reinfection, right now there has been some cases of people going, okay, I think people got reinfected in Korea, they retested positive. What they think is happening there is they didn't necessarily get reinfected. It's called reactivation, which means they were able to find a little bit residual RNA from the virus, a little bit of the virus left in their body. They didn't necessarily have the active infection, but just the virus, or they think possibly it was bad testing in between when they tested negative. So it doesn't seem like people are getting reinfected over the couple weeks after they leave the hospital, but instead those tests are just showing some residual effects from the original infection. But come this fall again, we all need to be guarded. We all need to make sure we're doing the things we need to do to keep things under control. But again, the couple headlines I talked about, number one, you're going to see things opening up more. If you're in a region that things open up, be extra careful when you're out and about. Just at least for the next few weeks, next few months, be extra careful. Keep an eye on each other, make sure we're all staying as healthy as possible. If you're from a region where it's not opening up, don't go out and try to do this on your own. Wait for the public health department to tell you, okay, we can go ahead and start opening things up a little bit, because there's a reason you're not as open as other regions, and that's probably because you have more cases. They're trying to keep a very close eye on them. And then I talked about an at-home test. Right now there's one FDA approved, it's under emergency use authorization, at-home collection kit. So if you hear of any others at home, they're not legitimate. Do not buy them, bottom line. Otherwise, I hope you stay healthy, I hope you stay safe, and I hope you enjoy the rest of your day.